Good evening. My name is Kate Loving Shenk, and today is November the 19th, 2008. The following is testimony I gave to the State House of Representatives in Harrisburg, Pennsylvania for House Bill 1660 and Senate Bill 300, bills that will deliver guaranteed health care for all Pennsylvanians. As a healthcare professional, I see people who are between jobs, who are in retirement or starting a new job, or who want to go back to school or move from one job to another, and they lose health coverage in the process, sometimes with catastrophic results when accidents or acute health conditions occur during these times. When people fall into these categories of the uninsured, healthcare workers, patients, and taxpayers all have to pay. From my perspective, when a patient arrives at the hospital with a large brain stem injury because of a major stroke after he stopped taking his blood pressure medicines when his retirement plan unexpectedly dropped his health insurance, and we resuscitate him just long enough for his family to arrive and say their goodbyes. And these and similar situations occur when patients between jobs and in retirement are forced to cut back and consequently die as the economy worsens. Suffice to say, nurses and doctors see these sorts of examples every day. Burnout in my profession results because of a healthcare system that isn't taking care of anyone. Or take the example of a man between jobs without health insurance with a job interview the day after his car slipped on black ice. He was flown by helicopter to an area trauma unit and spent 2.5 days in intensive care before he was moved to a regular hospital room. He sustained major injuries to his spine, including fractured and compressed vertebrae and shattered discs. This man was incapable of attending the job interview, a job he was favored to get, and now has a huge hospital bill after major surgery to his spine, transport by helicopter, and an extended hospital stay. Or the example of an 89-year-old woman, Meryl Kuznick, who broke her hip after suffering a major stroke on her left side. The nursing home she was in insisted that Meryl Kuznick apply for Medicaid to pay for expenses not paid by Medicare. When the paperwork was not completed in a timely fashion, local constables showed up to her nursing home room with guns visible but in their holsters and told her she would have to go to jail for 3 days if she did not pay. Merle's daughter, Mary Beth, went to KDKA-TV in Pittsburgh and told a story which the station covered, but Merle was emotionally challenged by the dual threat of incarceration and economic collapse. Our bill, House Bill 1660, pays for long-term care and does not involve the bureaucratic paperwork that was created ultimately by health insurance companies to deny payment to consumers. If House Bill 1660 was in place, Mary Beth and Merle wouldn't be going through this degrading experience. The question is, how many other of our elderly, as well as most people between employment, are having similar experiences that are the worst kinds of humiliations in what is not a civil society until we get a single-payer system instituted in our country? Meanwhile, the health insurance industry continues to lobby to protect their positions and profits, while the system they've created continues to disenfranchise more and more people in this country every year. I would be remiss if I did not talk about single mothers in these scenarios. I spoke to such a woman whose yearly income was about $18,000 a year, but because her ex-husband had insurance that covered little of anything, her 2 children did not qualify for S-CHIP. She went to her state representative, who gave her poor advice: to ask her ex-husband to drop his insurance, wait 90 days, and reapply to S-CHIP, not taking into account that her ex-husband was mandated by court to have such insurance. Consequently, her out-of-pocket and medical expenses continue to mount because of a system that allows too many single mothers to fall through the cracks. In sharp contrast, a healthcare system which includes full and unlimited medical, dental, prescription drugs, durable medical equipment, home nursing, mental health, Optical and substance abuse and hospice, long-term care and emergency transport, physical and occupational therapy will free all of us to make contributions to our families and to society. Malpractice, another overwhelming stress contributed to a healthcare system in crisis, will fade. America will be able to compete in the global economy. The stressors I have described will vanish. House Bill 1660 has the singular capacity to bring the haves and the have-nots together for a common cause that the Commonwealth of Pennsylvania and America desperately need. By having a civilized medical system in place, as Chuck Pinocchio calls it, we can serve our population of patients with a clear conscience. These are the greatest gifts of all. Thank you.